Everyone, I don't know if it's working, but Molo's having some technical difficulties. We'll see if we can bring him in. So tech. We're gonna give him. Nick, where are you? Fighting Nilo. People. All right, I'm saying something. See, got to my. All right, I'm trying again. Oh, hi, Sharif. I'm glad you canceled your meeting for this. Ooh, Michael's in the night. He's in the lobby.
Finally.
Hey,
Hey.
we did it! I don't know if anyone else can hear us. Can you hear me?
I can hear you just fine.
Okay, well, screw everybody else. It's just you and me.
It
Just
sounded
kidding.
like they could
I
hear us for a
think, I
second.
think it's working.
All right. I'm getting echoes, but that's okay. I'll figure it out.
You know, we got to start somewhere.
Yeah.
Okay.
That's what I was like. We'll be starting in 15 minutes.
Okay.
Actually.
All right. I got these like fancy new earphones because I was like, I'm a serious podcaster now, Milo.
Yeah.
So, and they're garbage, I guess. I need one of those like ones that clips to your desk that makes you look like you're a legit influencer.
Yeah. I need all of it. So,
Well, yay, we did this. And we're gonna talk for 30 minutes, maybe 24 minutes now. Actually, I've booked it for the full hour, so
we'll die.
if people get bored, they can just hang up, which is probably gonna happen. So.
I'm just like, can I even hear us? I can't find the LinkedIn one.
I mean, I feel like I'm watching it. I think there's like a delay. There's like some weird delay, but I think it's maybe just me. So,
Okay.
Margot says that's better.
That's
Monica
fine.
says you're making an echo, but I wonder if
I'm
it's
hearing an echo on my end too.
of like me talking.
I don't know. No, it's only myself.
Oh.
Let me see if I can fix that.
I don't hear the echo, so I wonder if it's just me. There is like an echo cancellation thing.
Yeah, mine's on. Says it can't be changed.
Yeah.
Well, you know what? This is the first one, right? We'll figure this out. Maybe we should have practiced.
Well, like LinkedIn doesn't let you practice very well, so
That's a good point.
screw it. Anyway, maybe I'll go get my other headset. Derek says he can hear us. So there are a couple house rules for today. Here, mute yourself for a second and see if that makes your okay. We have some house rules today. One of them being, I'm not gonna try and drop too many F-bombs because I have a tendency to curse. I had someone tell me one time, they're like, you really shouldn't do that. And I was like, you know, it's my life. Look at my life, look at my choices. We're gonna try to avoid politics if we can, you know, like we want this to be very inclusive and call everyone in and have like a nice conversation. But, you know, FDA is a political place and, you know, politics may come up, especially with some of the changes in policies and regulations. And then I think that's about it. We're gonna mostly try and like balance the good and the bad. We feel like there's a lot of spiraling and doom scrolling that goes on. So times we're gonna feel like we're in a pit of despair, but we're gonna try and lighten the mood a little bit with some jokes. So Nilo, I'm gonna start with my first joke. It's not really a joke, but last year, my New Year's resolution was to run 20 minutes a day. And it was great because if you didn't run that day, you push it to the next day, and you know you just do a little longer the next day. It's been a really big game changer. And 2026, I'm going to keep going with it. But so right after this call, I'm going to have to go run for 5 days, and then I'll be all caught up. So
I'll try to take it. My joke for today is not really a joke either. I turned 41 on Monday.
oh, happy birthday!
Thanks. And I sneezed on Tuesday, and now I'm walking around like Frankenstein because my entire back and neck like hurts to turn. And I'm like chasing around a 2-year-old who doesn't understand why I make weird faces when I try to pick her up. So yeah, that's where we're at.
Okay, I'm truth be told, I once was like on the toilet and I reached for toilet paper and I threw my back out. So it gets worse. I'm a little older than you.
Where are the medical devices that cure are old?
Yeah, can we get some longevity or age related reductions? I'm gonna go get my other headset. So you have to just like make the masses happy for a second. Why don't you start? And I'm gonna see if I can get my headset to stop this stupid echo thing that I got.
Sure. Yeah. Actually, when you leave, I can hear myself better. That helps. So yeah, I don't know. We're going to talk about some of the new stuff that's coming out of the FDA today, and just in general, whatever the heck we wanted to. I think the big topic of conversation recently for us has been all these crazy new clinical decision support and general wellness guidances. I'm trying to log into the chat to see if I can pull up if anyone has questions or stuff they want us to chat about. But yeah, I don't know about you, Allison, but I basically had to take a look at like my entire last 2 years worth of software as medical device like reg strategies and call all the clients and gone, hey, we might want to revisit what the heck we told you because what we told you might not be right anymore. All right. I don't know if you're having to do that, but that's been fun.
Can you hear me now? Can you hear me now? How about now?
Oh, I see.
Maybe now? Echo fixed? No more echo.
I don't have an echo on you anymore. I think what it was is I had the LinkedIn window open, which was like delay speaking with volume on too.
You're like one of those people that would like call in to the radio show and be like, "Oh my gosh, did I win?" And then they're like, "Turn off the stupid thing in the background. Don't listen to yourself."
You know how do people still call into radio shows, Allison? How old are we?
I don't know. That's a good question.
Yeah.
Were you talking about the general wellness guidance and the clinician decision support one?
Yeah, I was, and just the fact that I've had to call everyone, like all my old clients that we told them, yeah, you've got a medical device, start putting together all the stuff, and now we're calling them back going, we should take another look at that. You might be general wellness, and a lot of times they are. We're having a little fun with, they're excited. I don't know how I feel about it, but I'm like, in some of these cases, it was crazy that the FDA was gonna make them do clinical trials for something that was extremely low risk. In other senses, I'm like, hey, my dad's actually using this device to like monitor his blood pressure to make sure he doesn't have to go to the hospital. Like maybe it should be accurate. See, seems like a thing. I don't know.
I'm with you. I feel like it's a good reminder to all of us to always keep your regulatory strategy evolving with you and to make sure that you update it from time to time and like relook at stuff. Because I reached out to a lot of like clients from like 5 years ago, like before I was with Archeo and Plus, and I was like, hey, you should relook at your regulatory strategy because things just changed. I do, like, I don't know, cautiously optimistic, I would say. I will say there's been some really good help online, like Joshua Christ and Bryce Whited and, what was the other one? There were like a few people that put out like the side-by-side comparison of the red line document, and it was like you could download it. Like it was super helpful. So shout out to them. Go to their page and you can like, I don't know, it was super handy. Also just to see kind of like what actually changed in those two guidance documents, because there were some about like signal, the definition of signal, and some of the definitions that we have long held as truths. And I just feel like those, anyway, things are changing really rapidly. It's like the lab developed test last year, man. It was just like, it's coming, it's coming. Oh, just kidding. We decided to change our opinion on that too. So
Yeah, I'm always curious too from, when they make the decisions on high and they just kind of come through, it's like, how long does it take to the review divisions actually like incorporate this? Or are they gonna dig in and go, yeah, we're not ready for that yet, and avoid it? But the one thing that's, with wellness, you don't actually have to ask the review division. So maybe you just get to work with it.
yeah. Yeah, and I think a lot of it is like, I think people are gonna get, it has come to our attention letters if it's something that like a company's done that's egregious or right, or they've like wrongly classified themselves. But yeah, that's kind of crazy. The other one that was recently pulled down, right? The other news from this week is they removed the software as a medical device guidance document and just slowly, just like very quietly went into retirement. I don't quite know how to feel about it yet because it was actually, I mean, there were some things in that guidance document that were just like, oh, come on, this is like, no one's adopted the way of thinking about this. And then other definitions in that we kind of used as, no, this is how you yourself, FDA, are defining it. So I'm assuming there's going to be maybe another guidance document or something else that comes out that's going to be like, this is final.
We should, maybe we should have Annie Saha on this next time, but I kind of felt like they were trying to align with the IMDRF stuff. And so maybe they're like, if we're going to align with it, we can't have our own guidance. Let's just point to that one instead of upkeeping both. That's my hopeful interpretation of.
Nice. That's so, I love your.
I'm just like, let's make things simpler for me. I don't have to monitor two guidances. I can just do one.
Yeah.
But yeah, when they take down guidances, I'm always scary of like, oh, we're burning the books, like type thing. So, because they did take down a bunch of guidances last year around like IDE with the stuff around diversity in trials and stuff.
Yeah.
They just took them down. It's like, but FDA still wants that stuff. They're just not posted about it, so it's not helpful to them to remove it. It's good public information.
Yeah. I think it's always a good reminder for us to like download the guidance documents that you need, like the Wayback Machine or whatever it is that you can like go on and find them. It's not always reliable. So if anyone needs these guidance documents, I'm like a hoarder when it comes to computer files. So, but yeah, I think it's like, I'd love to see more rest of world alignment, right? If FDA is really saying like, this is going to be, we're going to follow the rest of the world, or is it going to be, no, we have our own definitions of things and that's what we're going to.
I am also a hoarder of guidance documents and old standards and stuff, but I need like a Marie Kondo to come in and organize it because they are named like.
Does it
whatever
spark you joy?
It would if I could find it. It would if I could find it. They're labeled like whatever I downloaded them as, and they're unsearchable. It's just a mess. So I need someone to come in and organize those. But
so other big news out of FDA. Well, at least I have heard through the grapevine. Is that they're doing performance reviews a little differently this year. Have you heard this?
No, I saw this.
FDA?
You put that on the thing, and I was like, I haven't heard this. So tell me the T.
So T is, and maybe I'll just like, is that like, so maybe explain for our listeners, or I think there's like two people here. What is a PMAP?
It was the bane of my existence. It was based, I mean, we've all worked in companies. It was kind of how you were rated at the end of the year every year, and you could get scores of 1, 2, 3, or 5. 4s did not exist at my time there. I don't remember why. And if you did well enough you could get like a bonus, but there was only a certain amount of people who could get bonuses. So yeah, I just remember going, I think I did good enough this year, and then getting a 3 because they're like, you did, but we can only give out 2 5s, and they went to, people who were better than me, frankly. So that I didn't feel as bad then, but
You're like, okay, I guess I don't deserve that. Well,
Yeah.
so word on the street is that the folks at FDA have been told that their scores have been inflated for too long, and so the agency is going to try and fix that. So like the managers at FDA are kind of being pressured to like give ratings that at best are like satisfactory, right? Kind of like what you were saying. But it's really, I don't know. I feel like there's more people leaving FDA by the minute, and then also a lot of people are, yeah, just like morale's pretty low there. And then on top of it, they're saying like your scores have been inflated for too long, so really only give like the best scores to really like the minimal people. And I think one of the things that we can do as industry folks to kind of help that is if you've had a really good interaction with a FDA reviewer in your life and you're like, that was awesome. Like they went the extra mile. They, really made sure that we got through with a favorable decision, then hey, maybe do a little letter or like write to that person. Because if you haven't noticed, they got rid of that evaluation. Remember the little link at the bottom? It said like, how am I doing? And you could like click on it and say like, that was garbage. But like most of the time, yeah, I guess we'd say like, hey, thanks. That was, here's my evaluation of you. And they really did look at those, but they got rid of those. So there's no really like good way to get feedback to the managers of these reviewers.
How just email the manager and be like, this person was awesome working with. Because I actually do have one that I'm hoping wraps up today that has been, he's definitely worked with us the entire way through the submission. And, shout out to, I don't know if I'm allowed to do, I'm going to hold off till it's.
Who's listening?
I don't know. There's some people in this chat room.
Oh,
That's a good point.
Oh, really?
Yeah, I think so.
Oh, hey,
I
look.
can't tell me. Yeah. You know what?
I know Sharice here.
Shout out to
Dr.
Shout out to Virag in OHT3. He's been really good to work with. There's not a ton of FDA reviewers that still have the time to do like calls and just be like talk through and brainstorm good ideas and stuff. And he's been really cool to work with throughout a project that we're hoping is coming to an end. So yeah, so I'll give him a shout out. I'll talk to his manager. That's good feedback.
Yeah.
But
I think you could send it to them. Like you could send it to the reviewer, or if you know who their AD is and their AD is still there, because I feel like a lot of managers just left FDA. And I feel like with this vacuum, I'm just like, oh my gosh, like who's gonna be there?
I've had a bunch of clients asking like, how's the timelines going? And I'm like, still shocked that the FDA is still doing their job and meeting the goals for the most part. I'm like, I have no freaking idea how they're doing that because everyone's leaving and everyone's mad at them. So, I'm mad at them half the time, but I'm still like really impressed that they're doing, they're doing the best that they can and meeting the goals and stuff. So, speaking of being like mad at them, one thing that I wanted to talk to you about because
Okay,
I just
everyone
don't
close your
know.
ears.
Yeah, everyone close your ears. I'm about to air my grievances. I've got a problem with you people. You're about to hear about them. How do you deal with the last minute labeling changes? I feel like they're coming. It was like we were taught that labeling was not that big of a deal, and hey, work it out in the labeling at the end of the submission was kind of like common. But the longer I do this, the longer I'm like, that's totally fucked. Oh, sorry, that broke the rule. That's totally.
Each get one.
dumb.
How about that? Let's
Okay.
like each we'll pick
Okay.
one.
So, but it sucks. Like these companies would rather redesign their product than change the labeling because the labeling goes into all their reimbursement strategy, all this stuff. And like but I know that that's what I was taught when I was a reviewer, and I assume they're still being taught that it's not that it's the easiest thing.
Just like change it. Yeah. Was it
Yeah,
indications or what was or was it
Indication.
like warnings?
Indications, contraindications, patient population within the clinical trial results, how we like analyze like what tables went into the clinical summary, but at the very end, it wasn't showing up at the AINN letters. It's showing up in the last like 3 days. And it's like, do this, do this or you don't get approved. And it's like, oh no, well,
That's not good.
okay, and it's not good. And I'm like, how do we? Yeah, how do we change that? I wanna go into the FDA and be like, do they still do show and tells? I don't know.
Yeah.
Like this is bad.
I mean, I do push back on substantial changes to the labeling if it's like, well, why? Like, what is it? Like, of course, you got to give me four-part harmony, right? Like, this is what it said the whole time. If this is something that's going to end up in an NSE decision, why did I not get it on day 60? Right? Like, if this is truly something that there's a regulatory or scientific reason for this change, then that's a major deficiency then, if that labeling wasn't done how FDA wanted it to be. So I would often, I don't know, it's a negotiation process at the end, right? Like, so I'll often push to say, well, that does not suit us. How can we revise this to make you happy, right? Because at the end of the day, you want them to say yes. But here's maybe what my client or this company is like open to accepting. Otherwise, I've been using more frequently is the Blue Book Memo G91-1, and the reason is it is like 1991, like woo, different era. But the beauty of it is that it really clearly spells out what's a warning, what's a precaution, and what's a contraindication. And I feel like sometimes, I mean, I didn't really know the difference between those three, and I still go to that guidance document to like really review it and say like, oh, okay, this should not, like, we had one recently, the FDA was like, can you please add this to the warnings? And we're like, I don't actually think that's a warning, or maybe like, how do we avoid that warning? And it was a nice conversation with the consult on the file, because they were like, well, if you do this and this, let's revise it, we can work on it together. But otherwise, I'm with you. The last minute labeling changes, like, give me a 510K summary change any day. Like, sure, what do you want in there?
Yeah.
You want me to draw you a picture? I'll do it.
Yeah.
I'll make you some French fries. But otherwise, like the labeling stuff, or, the ones that you always freak out about are, it's like, please provide new test data within 24 hours. And we're like, oh, that's not good.
Yeah, that's from where, like, sure.
Ooh, here it is. Yeah, exactly.
Yeah, my that's a much better strategy. My recent one has just been lying to Ken Skadacek. So,
is he on like speed dial on your phone?
Yeah. Yeah, absolutely is. It's my wife, my parents, and Ken.
Ken Skadacek. He's like on my favorites list too. I feel like, I mean,
poor guy.
On my phone, but also in my heart. And
yeah, absolutely.
And then we're not getting paid. This is not sponsored by Ken Skadacek, but big fan.
Yeah. Also a big fan.
I think that's it. Like we always talk about like who's our favorite reviewers, and like the favorite folks at FT are like the ones that'll pick up the phone. Like, can we just hammer this out? Can we just get this last piece done? Especially if it's like, day 88 or day 89 deficiencies or questions. If this is a 510K, but even for some of the like pre-subs and the submission issue requests, it's like, can we just talk? Can we just talk? Can we just like,
yeah,
mano a mano?
Yeah, I've got a couple of like more complicated ones. Like I just want to talk to you guys like a little bit on the way through this, but they're busy. I understand.
Yeah.
Ooh.
I wanted to point out there's a couple big things that happened. There have been some really cool de novos that came out. I'm going to be talking about them probably on like Blue Stocking Health stuff. But then there was, Sharif mentioned there's been a new treatment for Menkes disease. I don't know if I said it right, which was pretty exciting. And then also the Bayesian guidance came out, not super technical, but also like very, I don't know, just more ways that we can try to address what evidence is actually needed to support the indications. So,
Oh, that's cool.
yeah.
I did see some of the new de novos, and I won't steal content from your blue stocking stuff, but those have been,
Steal away.
uh, um, no, those have been great. And I do think that um, there's been so many guidances coming out that I think I missed um, the Bayesian one. Um,
Yeah, use of Bayesian methodology in clinical trials of so it was for drugs and biologics, but I always feel like devices are a little slower to catch up. So it's a common, and I also like even for some of the drug like CDER guidance documents that come out, we'll use them as like general use, right? Or like general use guidance, or even FDA. Like we had a deficiency not long ago that was like, um, well, there's no clear guidance for this. Please refer to this drug one because it's at least a good starting point of what our expectations are. And I was like, no, that's helpful. And it was. I mean, we kind of just like replaced the word drug with device, and it worked for us. So, yeah, I feel like there's so many changes. It feels like there's stuff coming at breakneck speed. Actually, Dr. McCary had an interesting video from CES that kind of
yeah, I saw
circulated
that.
in my cohort. And he's been really out there giving talks. So I'll probably put some links after this, like we wrap up today, and I'll put like the various links and guidance documents that we talked about. That old school G91-1.
I did see right before, like over the holidays, that there was a couple of like stim devices used to treat depression that came out, which
Yeah.
I always think it's interesting. I mean, one, that's kind of cool, but it's also like scares me because it makes me think of like electric shock therapy, but
Yeah.
like calm down a little bit. But it's interesting to me when FDA decides to like approve. I don't know if it's the submission timing or whatever, but there always seems to be like 2 or 3 devices that all get PMA approvals with the same indications within like weeks of each other. And I don't know if it's just like, oh, they're competitors, so they all went in at the same time, or if FDA was like slow to kind of develop their position and then they all kind of come out together. But I saw there was 2 or 3 of those. That was kind of cool.
Yeah, there was a PMA that came out. I mean, it's the person that everyone should talk to is probably, and I hope he doesn't curse me for saying his name, is like Tim Marginin. He's done so much work in that space, and I think he was also pretty integral in like cranial electrical stimulation for various indications and like which ones were class 2 and which ones would need a PMA. I often feel like you're right, like a lot of companies may have the same or like a similar idea and they'll send them into FDA. We've had some in the past where like FDA said, listen, there's 2 de novos in, we're gonna try and like grant them on the same day, or like otherwise if one gets a granting or one gets a PMA approval before, like they're first, right? So unfortunately for de novos, then you have to like withdraw the dang thing and then like submit a 510K. It's like, oh, we got so close. Michael Owen said, talk about how tightly they are writing the regulations for the de novos. I've noticed that too. So like, I kind of am a super nerd for de novos, and I feel like because they're just, it's usually like cool stuff, and it's also, first of its kind from, more or less, and it's like the no predicate, so it's new regulation. And I feel like historically, like we saw for like the cognitive behavioral or computerized behavioral therapy for psychiatric disorders, like that regulation was like so broadly written, and you see like how de novos were kind of intended. Like if you can control everything with the same special controls, like we've seen now, it went from Reset, right, with paratherapeutics,
Right.
and then they had Somryst, which was for insomnia, and then there was one for major depressive disorder. There's been one for postpartum depression. Like it's really cool to see they're predicating off the insomnia one or predicating off the previous ones. But it either can get a new product code, but it stays within that regulation. And I kind of love that idea of like, get a broad regulation, FDA, give us a broader regulation so we can get our foot in the door. And then maybe there's a way to like generate new product codes. I have had pushback from FDA who said like, no, we want to keep it narrow. We want to keep it tight, as Owens was saying, because we want to make sure that the special controls will cover that. And so if there's another company that's going to do something similar, do another de novo. And I'm just like, I don't know if you have all that time. Like, I feel like de novos take a lot of effort from the review team side and FDA side that I'm like, maybe if we broaden the regulation a little bit, then it might help with some of the resource, you know, suck that we've seen at the agency, right? Where they don't have the time to do it. So anyway.
I agree on that end, although I like de novos from like submission end because you're not comparing to something else. You're like, this works and here's why.
Yeah.
And it's not like trying to fit a square peg in a round hole. You're kind of like, you get to make everything just to fit, you know, it's PMA light. And to me, that makes more sense. It's easier to tell that story sometimes. Whereas when there's these really broad regulations and you're trying to compare across indications but still do it, it's a fun puzzle, but I just always feel like, why do I have to say I'm substantially equivalent to that one? They do something completely different. And it's a regulatory nerd thing, but it doesn't make sense to the clients all the time. And just like, but it should be like something in between of, you know, I think they try to do it sometimes with the 510Ks with the safety and performance pathway, but that's more for established stuff. And I'm like, can we do that for new stuff too?
Yeah.
Where it's like, But.
You mean like having more of like an abbreviated submission type thing? Like, here's the testing?
Yeah, here's the testing. I don't need a substantial equivalence part of this because I'm not using any of their clinical or marketing knowledge, but I did follow the special controls and I did do all the testing that made sense. And I just didn't want to pay extra or have the longer review time or write a new regulation. Like you said, like product codes within an existing reg would make sense.
God, there's some crazy regs out there. Like the one for like pulmonary calculator that has all the insulin calculators in it. I'm just like, yeah, there's been some creative pro codes within some regulations, and you're like, I don't know why it's there, and it doesn't make sense, but yeah.
That would be a good, you know, when all the funding goes back to the FDA eventually, a good project would be going back through, because they're going to run out of letters pretty soon. We're into the mid S's, I think.
That is like the least of our problems right now, Nyla.
No, that is number one problem in the United States right now. We're going to run out of pro codes.
We're going to run out of pro codes. It's like Y2K, you know, everyone was like, oh, the world's going to end. And it was like, we just came up with more letters. No, the thing I'm worried about is like what about the K numbers? Like, I won't be alive when, you know, when 2100 hits, right? Or like by those last two digits, like
wait. Yeah, that would be a lot of 510Ks. You know, the start to the year changes every year.
Yeah, but the first two digits of your K number, right? K91 is the year, and in 2091, we're gonna have like, what are they gonna do?
That's a problem.
Again, biggest problem the U.S. is facing at the moment. Just so everyone knows, like.
Yeah. Hey, Y2K was only avoided on the backs of really smart computer engineers, or else it would have been a big problem.
That's true. That's what's gonna save us.
Yeah.
Again.
We're gonna just dig those people up. One thing I did want to talk about before we have to like wrap and run out of time was that Tempo Access program.
Oh yeah, everyone's talking about it.
Everyone's talking about it. I think, you know, JPM and CES just happened or are ongoing and stuff, so I think people are talking about it. But I've had a bunch of clients, we've applied, but I've heard a couple of people say like the slots are filled, even though it's not supposed to happen until March. Did you hear that?
I have not heard that, but I mean, this is what kind of crushes my soul. Like, remember when they had the pilot program for like opioid, like technologies, and then they had pre-cert program, like the folks that end up getting those, like the 9 positions, I think it was like 9 slots for one of those.
It's always 9.
Yeah, and like it was the big dog companies. It was ones that had like a lot of maybe not even a lot of submissions in front of FDA, but they, I don't know. It's like they kind of, I don't think they cut the line. I think that FDA is like, yeah, those ones, like we want to work with them. I don't know.
I, I, I sometimes think it's like applying for the job that they had to post it because
Yeah,
like legally they had to, but the job's already filled.
it's
Like
already
they
filled
already
from
know.
somebody internal.
Yeah, someone internal. They wrote the job description specifically for that person,
That
and
person.
yeah, so it might be
Yeah,
one of those things. But I have heard that those might be filled already. So,
that's
hope
crazy.
hopefully I'm wrong and people can go take the next 2 weeks to go apply. But I have a feeling that like, so at least some of the 9 are filled up, 9 or
Yeah.
10.
Can we just expand the program to like, I don't know. Like I feel like digital health is, and I mean, a lot of these companies and kind of what my thinking of, starting Blue Stocking Health was like, so many companies get through FDA, which is what you and I have done for so long of like help these companies get through, and then it's just like, oh shoot, who's going to pay for this dang thing, right? And I feel like the companies that are ahead, the ones that like really think about their reimbursement strategy or like who's actually going to buy this. And if tempo and access kind of helps give some of these companies a head start, leg up, I think it's good. Like we need the payers to be more open to.
Yeah, the top program has a little bit of that in it too, which I've got a couple of clients in there, and that's been utilized at different levels, but it's been helpful. The
Yeah.
interaction there, and I think, I know Matt Hillenbrenner was kind of at the top of that for a while, and he recently left for Fogarty, but which is awesome. But well, hopefully that program continues and keeps accepting people in. It's got to be resource intensive though. Like
Yeah.
we have
Yeah.
meetings with the review teams, every 2 weeks. So, but the TAP
How do you
advisors are awesome.
yeah, Kimberly, freaking
Yeah.
shout out to her.
Yeah.
How have you felt like? Are your review teams like enjoying it, or do you feel like they're getting burnt out?
I the ones I have in cardiovascular, I think I don't know. They're not, I like working with the cardiovascular team, especially on the plumbing side, but that's because it's I worked with them while I was there, and a lot of them are still there. So,
Yeah,
um, maybe they're just being nice to me, but they seem to enjoy it. Then
yeah.
they might turn around and go, oh crap, I got to talk to Nyla again in a week. But you know,
They're like, what are we gonna talk about?
yeah, but I don't know. When I was a reviewer, like those types of programs typically are cool projects. They're not just another, sorry for the people out there that make dental screws, but like it's not another, you know, easy Me Too 510K. They're like innovative. They have target populations that are cool. They're breakthrough devices. So those are the projects you want to work on as a consultant. Those are the ones you want to work on as a reviewer. So
Yeah. Let's put a pin in breakthrough and step and maybe talk about that next week because I'd love to hear some of your opinions on like those two programs. I feel like everyone's been saying like I want a breakthrough device. Like, can we submit for breakthrough? And I'm just like, let's keep talking about it and figure out
I,
if it's right.
I, we've kind of gone. We don't think so, but if you want to pay us to put it together, the worst that happens is they say no.
I know, but
So
like but also, okay, we're already getting into it. But like, I feel like part of the worst of it is like, it also sucks a bunch of resources at FDA with like people they don't have. Like, I mean, OHT1, man, ophthalmics just lost a bunch of people, and then now they're like, and I don't know if you saw my Nostradamus LinkedIn post because I was just like, I was like, I'm gonna Nostradamus this, but mostly maybe Nostradamus is what I should have said. But my thinking is, I'm like, people are leaving and they're gonna keep leaving, and it's gonna be like, well, but now we really have to lean into AI and like having review like deficiencies written by Elsa, which there's a case for that. What scares me is that we've gone like like deficiencies where it just feels like it was like bleh, like spat out from from Elsa and then just like said to us, and we're like, either sometimes it's there and it's like, then you look like the a-hole that's saying like, did you see it over in that attachment? Or it's like, oh my gosh, is all of this mission
I
critical. I don't know.
I I have lots of opinions on Elsa and all of that because of the garbage we're getting
Yeah.
when it's obvious it's being used. So maybe we put a pin on some of that, like breakthrough AI use at FDA, and some of the other things that we could talk about next week.
Yeah. I will say the reviewers that I've talked to that like use Elsa and use it well are just like they love it, right? Like I think for example
To
like
write your memo,
biocomp. What's that? To
to
write
write
your
a memo
memo,
would be
but even like to like, hey, here's I think you can only put like 10 things, 10 reports supposedly into it. I don't know. People can call me out on this if I'm wrong. And then like it'll like you can say this is what I need you to look for. This is what like make me a table that says whether or not they passed and like so it's a tool, like just like most AI things out there, it's like it's a tool for now, and like if you use it well, then it can actually really cut down your review time. But I do think people need to like any AI, you need to like review it and make sure it's like, okay, is this actually what I asked for, and is this accurate? Otherwise,
yeah.
bots are coming for us, Nilo.
I don't know if I am a bot. This is a recording.
That's
Yeah.
you can do that. There's like ways that you can like make an avatar of yourself. I was like, maybe I just like outsource my whole
Were
self.
Were you just watching Severance? I don't think that's real life yet.
I watched Severance. Have you watched Pluribus?
No.
It's so
Okay.
good. It's on Apple
2-year-old.
TV though. What's that?
I got a 2-year-old. I'm not up to you. You remember? I'm not up on full new TV. I'm watching things that are.
It gets
I'm still trying to watch the end. I'm still trying to watch the end of Peaky Blinders, which ended like 4 years ago. So
catch up,
bye.
man.
Yeah.
There's too much TV out there. I feel like sometimes,
Yeah.
and when my husband and I are watching TV together, we don't binge. We just like do one episode. But when he's out of town, like all holds are off. Like I just watch until my eyes bleed, you know. So anyway, we get off topic. I was gonna say, is there anything else? Anything else that you like exciting, devastating coming from FDA from this week that you're trying to keep up with?
I think we covered the big things that I'm trying to keep up with, and then we've had some recent successes, so that's always fun with PMA approval and a de novo coming up, and so those are always kind of fun ones. So hopefully, those balance out the times I want to. I'm pulling my hair out because I don't understand how the FDA came up with some of these questions. So yeah, good and bad.
Yeah, same. I feel
Yeah.
like what I worry about this is gonna sound like a weird thing to worry about, but like with people leaving FDA and like there's kind of like the pendulum, right? A lot of folks thought if like a lot of people leave FDA, then is it gonna slow things down? Are things gonna get slower, or are things going to is the bar gonna get lower, right? So slower or lower? I like that. And I feel like I've noticed the slowness starting. Like there have been some submission issue requests that I've heard of that people are like, they told us they can't get it because it's as resources allow, right? That's always the catchphrase. And so if it's like, we really need this feedback within 21 days because we need to figure out if we're going to do the, how to do the testing or to make sure we do it right to address FDA's question. And I think if those things slow down, then companies are just going to like pull the trigger, run the test, and then run the risk of getting the unfortunate decision. Or like, does FDA just say like, I don't have enough time to review this. Like it looks fine enough. Or, they're like, oh, Nilo submitted this, so it's gotta be good. Right. Like there's got to be something that gives, and I think for right now we're just seeing things get slower, and it worries me.
We're split, and it's by review group. Some of them are slower, and the other side is they're fast or faster, but the questions we get or the feedback is, I won't say dumber, but like kind of. It's dumber. No, I'll say dumber. It's like maybe it got
You're
fed
in a safe
through.
space. No one's listening.
Yeah, yeah. Maybe it got fed through the AI rut, or maybe it's just like, hey, I'm gonna run through this as fast as I can and throw out whatever questions I can, which I don't think is new from the FDA, but it seems to be more common. We're seeing some of that going. Exactly said. You don't want to be the jerk of like, well, if you look on page 3, it's there. It's also on page 6, and it's just like, crap. Like, I hated when people did that to me when I was a reviewer, because I was always like,
see it? Did you see what was said?
And then you run the risk of them being like, yeah, I don't know, I saw it. It just wasn't sufficient. And
yeah, it
like,
sucked.
shit.
And
yeah.
you have to balance that too, telling the clients of like, the clients are like, they didn't even review our stuff. I'm like, well, maybe they did, and they just thought it sucked. Maybe let's take another look at what we wrote. But yeah, I've had both sides. I've had actually more, but like I said earlier, they're still meeting their timelines and goals, so we haven't had too much delays.
Yeah. I mean, I guess the pre-sub ones are the where I've seen like the submission issue request, and then I've seen delays. I haven't seen delays so much on decisions, maybe like 1 or 2 here and there, but pre-subs are pretty valuable. I mean, I guess maybe we just move closer to like what the EU has, and like there are no pre-subs, right, for CE mark and like for notified bodies. So yeah,
we'll save it, but I think we're fast having to start our own U.S. notified body. With all the people who just left the FDA, we'll just start a new FDA on top of the FDA.
FDA light. We could be like an accredited body, right? Kind of like the third-party program. One of the questions was, have you noticed a slowdown in review decisions that aren't deadline bound? Yes, those are the ones I've seen.
Absolutely.
And I think,
for sure.
Oh, Nick Werner. I do miss the telephone holds. That's what they called it, right? They would just call you like, or you got a second hold. You're just like, maybe that's what they should go back to. I'm just going to go back to the second hold.
Second holds were...
Medufa would be damned.
I think second holds would probably resolve some of these, the gun to your head last minute labeling change requests.
Yeah.
But I remember also doing incomplete responses. If I started reviewing it and be like, turn the clock back. This response is not good.
Would you just like find the first thing that wasn't good? You just like
absolutely
like, kick it out.
Yeah, I'd be like, this incomplete. Send it back. Try again.
All the tactics.
Yeah.
So. Yeah, I just hope that there's like, I don't know, something's got to give. I feel like, there are some changes that are going on that make a lot of sense. And I'm like, yeah, that actually, hey, risk-based approach, right? And Lee mentioned as well, like the 10-to-1, right? Like you're supposed to get rid of 10 regulations or get rid of 10 for every one new one that you generate. I think that it doesn't pertain to like de novos, of course, but like, yeah, there's a lot of deregulation that, I don't know. Maybe we should come up with a list. Like we're like, get rid of these 10.
Yeah. We could come up with 10 by the end of the next hour.
Let's do it. Yeah. I'll just ask ChatGPT.
Yeah. Can we get access to Elsa? That might be helpful for us, or whatever.
Oh, that's a good idea. We could just like pre-run it for them and be like, this is what it found,
Yeah.
I mean, it's like eStar, right? Like eStar, I've been so happy with some of the things that I was like, at the last minute, we'd be like, oh, let's go through everything, make sure we check everything. We're like, oh, shoot, we don't have this thing.
Yeah.
And we should add that. Actually, maybe also newsflash, they are updating eStar. You can now submit your IDE, but it's through the pre-star eStar. The pre-star
I hate
eStar.
I hate the pre-star eStar though.
I know. Yeah.
But
But there's new things in there, right? Like they're slowly getting ways like to template everything. Which hopefully reduces some of the questions people get because they have those. I love those little toggle question marks, and you're like, "What the hell are they talking about?" And you click that, and it's like, "Oh, here's the information."
eStar is like, as much as I hated it when it came out because I was just being a curmudgeon, it is super helpful.
Yeah.
So. But.
Agreed. All right. Well, we're coming up on time. Thank you. Thanks for doing this. Yeah. I always feel like I learned something new with you. And also, maybe just a reminder to everyone, like, send some love to your lead reviewer. Don't be super ass-kissy, but just be like, hey, you were a great reviewer, and maybe here are, like, the 2 or 3 things that I was really impressed with how you communicated. Or like I'll always say like your deficiencies, if they're written well, I'm like perfect 4-part harmony. Like it's so easy to understand. Didn't need a 10-day call. So anyway, give some love to your reviewers, or if you know their manager, you could CC them on it as well. But I think that goes a long way for the performance reviews they're gonna be going up against. We need FDA people there, guys. So
For sure. Yeah. Shout out to Ken, always.
huge shout out to Ken.
Yeah. But yeah, looking forward. You know, we had 30 people join today to listen to us chat.
Did we?
I'll
Are you serious?
I think more than that at some
Door.
point. Yeah. I'll chat with you with no one listening to, so it's always fun, but this is kind of cool too. We'll figure out some of the technical issues for next week.
Love it. All right. Thanks, everybody. Thanks, Nyla.
Bye.
Bye.